millions of people in the US are affected by bipolar disorder every year. In fact, approximately 1 in 5 US adults experiences mental illness, and over 3 million experience bipolar disorder. But only about 46% of adults are actually to receive treatment for this. So with me is Dr. Andrew Cutler, the Chief Medical Officer at Neuroscience Education Institute and a Clinical Associate Professor of Psychiatry at SUNY Upstate Medical University, and also Karen Lidrell, who is a patient living with bipolar disorder. So let's just start with Karen. Give me kind of an idea of what it's like to live with this.
So I was 19 years old when I started experiencing symptoms of bipolar I disorder. I would feel wired and have trouble sleeping. I started noticing problems with my memory along with changes in my mood. But at that time, I couldn't see that these were actually symptoms of something else, that they might, be part of a bigger picture. And over the years, I would know that something was wrong, but I just wasn't sure what it was. And finally, I met with a psychiatrist and I shared my family history and my symptoms, and I was diagnosed with bipolar I disorder at the age of 34. So my journey, from the start of my symptoms until I received a diagnosis was 15 years.
Yeah. So Dr. Cutler, explain a little bit about that. Like, what do people just think, trouble sleeping? I mean, I have that kind of on a regular basis. So, I mean, how do you diagnose this?
Well, bipolar I disorder, as you mentioned earlier, is quite common, and it's a real genetic brain disease like other chronic medical illnesses. It can last a lifetime and it can be episodic, but it can be managed. The symptoms are very real, and it's a condition that can cause unpredictable high and low mood and energy changes that we call manic and depressive episodes. And these episodes can cause significant impairment and distress. And that's really the important point. We all have symptoms of moodiness or trouble sleeping occasionally, things like that. But this is a serious condition that really causes a major impact on people's lives. It can be difficult to diagnose because the symptoms can look like other conditions, especially something that we call major depressive disorder or unipolar depression. And as Karen said, the symptoms are not only psychological, like depressed mood, not enjoying things, hopelessness, but also physical, sleep, appetite, and energy. And so it's so important to speak with your healthcare provider. And bipolar I disorder is complex and often misunderstood. And that's why Karen and I are here partnering with AbbVie to help raise awareness of this condition.
Mm-hmm. So did you say people should just kind of, when they go for their annual physicals, just kind of before you go in, just take a note of, okay, what are some of the things I'm experiencing right now, and have those ready to tell your doctor about so they can explore a little more if there might be something deeper there?
I think that's an excellent suggestion. I always recommend that people ahead of time before a visit write down all of their concerns, because sometimes in a visit, things are moving fast and you might forget to bring something up.
Okay. Karen, do you feel like, I feel like mental health is being like, I'm even seeing some brands, General Motors, and there was an article in the Wall Street Journal over the weekend about how brands are kind of saying they're attaching to mental illness as we become less stigmatized. How do you feel, especially since you've been dealing this for a while? Have you seen a change in that?
Definitely feel like there's been a change. When I was first diagnosed, I was 19. There was really no precedent on how to go navigate getting a diagnosis. There weren't really places online to go to look up the symptoms of each thing. And I was young. I was terrified. I didn't want to go talk to anybody. And I feel like that, idea of talking and figuring things out has really come a long way.
Mm-hmm. And you said,
I think stigma's gotten a lot better too, and especially with COVID-19, that's really raised awareness of, mental health in general and depression in particular.
Yeah, well, that was a tough thing for all of us to go through. So, what were some of the symptoms you mentioned, Karen? Lack of sleep. What were some of the other things that made you go, you know what, this is more than just I'm not tired tonight or whatever? What were some of the symptoms people can look out for?
It's more than just one night of not sleeping. It's a prolonged period of time. For me, I think I started experiencing a manic episode before I experienced, a depressive episode. But once I had experienced depression, I knew that, this is something I need to go talk about. And I think Dr. Cutler, touched upon this, but, I actually went and talked to someone because of depression, not because I had experienced mania and manic episodes.
Dr. Keller, what do you see in terms of not just bipolar, but other mental illnesses that people should kind of watch out for and tell their doctors about?
Well, as I was saying, we all have different moods and we all have the occasional problem. But I think Karen said it well. When you're talking about something prolonged that lasts weeks or months and really has a significant impact, makes it hard for you to function or hard to enjoy things or just feeling anxious or depressed all the time, I mean, that's really when it's time to talk up and speak up and get some help.
Okay. Thank you so much, Dr. Cutler and Karen, for sharing your expertise and your story with us. And hopefully, we can help other people.